Come on, do some physical exercise. Physical training exercise for PWDs. Whether you have a speech impairment, learning disability, hearing impairment, mental disabilities, visually impaired, physical disability, or multiple disability, this training video will be helpful to you. Did you know? Over 1 billion people globally experience disability. This means that approximately there is 1 person out of 7 who experiences a disability. However, the fact is that people with disabilities who do not exercise are 50% more likely to have at least one chronic disease than normal adults. These chronic diseases include heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease. It is a well-established fact that the effects of these chronic diseases can be reduced by conduct physical training exercise regularly. The most typical effects are the prevention of heart disease, type 2 diabetes. Although exercise is essential for good health, according to the National Health Interview Survey 2009-2012 from CDC National Centers for Disease Control and Prevention, the number of people with physical disabilities who regularly exercise on a regular basis is only half of the normal population. This creates a vicious circle. Of course, the benefits and importance of physical training exercises for PWDs are not only that. For PWDs, the benefits of physical activity are, creates opportunities to meet new people and feel part of the community, improves mental health and quality of life, makes maintaining a healthy weight easier, makes daily tasks easier and increases independence, helps to prevent chronic disease, improves mobility and balance, improves fitness, strengthens muscles and bones. For physical health, regular physical activity reduces your risk of dementia by up to 30%, hip fractures by up to 68%, depression by up to 30%, breast cancer by 20%, colon cancer by 30%, type 2 diabetes by up to 40%, cardiovascular disease by up to 35%, all-cause mortality by 30%. For mental health, physical activity can reduce stress levels, reduce anxiety, reduced risk of depression, improves social well-being, increased self-esteem, boost brain power. So the main purpose of this video is to introduce available physical training exercise programs for people with disabilities, along with detailed steps, including aerobic, strength and flexibility. And of course, to improve the health and reduce the risk of PWD as in developing several diseases. In a nutshell, it is the hope that all people who are suffering from a disability get a better life. Hearing all these benefits, are you impatient to start exercising now? Wait a minute. Attention! You need to know the exercise precautions first. Firstly, PWDs who have below symptoms are strictly prohibited to conduct the exercise. Pregnancy or postpartum period. After surgery. Infectious disease. Psychological period. Osteoporosis. Spastic. Anemia. Asthma. Concussion. Chest pain. Heart disease such as heart attack, arrhythmic, lung disease, or other congenital heart diseases. And hypertensive patients who have low blood pressure or blood glucose. Next is the preparation for the exercise. The first thing is to ensure that the environment around the exercise area is safe and away from dangerous things, especially sharp objects. Otherwise it may cause danger. Secondly, you should fully inform people around you so that they are aware of this in advance. This way, any issues you sustain can be dealt with promptly. In addition, it is important to have a proper diet. Drink plenty of water before and after exercise to prevent dehydration caused by exercise. Avoid being hungry or full before exercise. Avoid high-intensity exercise after dinner. Wear appropriate clothing when exercising. Wear such supportive shoes, comfortable and loose-fitting clothes that will not restrict your exercise. Lastly, and most importantly, if you feel any symptoms of discomfort during exercise, such as headache, lightheartedness or dizziness, you must stop exercising immediately. Well, I guess you can't wait, so let's start the official workout. Let's go!
Before we start our training, let's begin with some simple warm-up to prevent from injury. The warm-up consists of 4 movements. Try to aim for 10 reps for each warm-up to prepare your body for the upcoming exercises. The first warm-up is shoulder forward stretch. Let's move your arms straight forward in front of you. Make sure the arms are parallel to the shoulders, as to get a bit of mobility to the shoulder joints, and then pull your arms backwards. Let's start. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Next, we are coming to 1 forward and 1 backward. Let's start by moving forward with a straight arm. Then add in the other arm moving backwards. You may push that a little bit further to feel the stretch, but always remember to keep your shoulders down and away from the ears. Let's start. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Overhead stretch is next. Reach your arms upwards. Then, bring the elbow back down tightly and repeat. Try to reach your elbows straight when going up and tighten your elbows when lower down to feel the stretch on the shoulders. Let's start. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Before we start the exercises, let us do a little bit of breathing exercise to expand our lungs. Let's take a deep breath by breathing in through the nose and breathe out through the mouth. Remember to pay attention to the rhythms of your breath. Take it slowly and evenly. Let's start, and that's the end of the warm-up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. That's all about warm-up exercise. See you. Now, let's start our training program. This program involves 3 types of trainings. 1. Cardiovascular training. 2. Strength training. 3. Flexibility training. The first training is cardiovascular training that focuses on working the heart and lungs to increase cardiovascular endurance, which is also sometimes called aerobic exercise. Here we introduce 4 wheelchair aerobics exercises that can be done easily. Try your best to do 2 sets of them with 30 seconds each exercise and 1 minute rest in between sets, or even longer as you needed. Let's get started with marching arms. Swing your arms pretending like you are marching on the spot. You can add a little twist to the core and engage it. Do it at your consistent pace, neither too fast nor too slow. Let's start. Next is upward punches. It is a simple exercise. Just hold your fist into your chest and punch up alternately. Remember to keep your core tight and make sure your shoulders are leveled. Let's start. Side punches are next. As similar to upward punches, but punching out to side this time with core engaged and shoulders are parallel. Let's start. Coming up next is breaststroke swimming. Imitate the swimming movement by pulling your arms outwards to slightly wider than your shoulder width. Then return to the front. As usual, remember to keep the pacing constant. Let's start. Let's take a minute break before the second set of exercises. Adjust your breathing and replenish some water. Follow the actions in the video to move your lower limbs. Okay, let's start the second set exercise now. Marching arms. Next, upward punches. Next, side punches. Next, breaststroke swimming. That's all about cardiovascular exercise. See you. The second training is muscle strengthening exercise that focuses on upper body strength. It is a set of user-friendly seated workout that is suitable for the wheelchair users too. In this training, we have got 7 exercises that target the arm, core and the back muscle. Try your best to perform 2 sets of 10 reps for each exercise, and you may take 20 to 30 seconds rest in between each exercise. Work on your form, and you should be getting stronger after each workout. For lower impact alternatives, you can do this workout without equipment but use them after you've progressed further. For those using equipment, have a set of light to heavy dumbbells or resistance bands by your side. Just do your best. Let's get started with front raise. Grab the dumbbells at both hands and raise the arms forwards up to shoulder height. Then lower it down with control and repeat. Engage your core, keep the arms fairly straight. Do it nice and slowly. Do not shrug your shoulders, and make sure you are raising high enough, but not over your shoulders, as you don't want to injure yourself. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next is lateral raise. Similar to front raise, but raise the arms up and out to each side to shoulder height, and the body is forming a T shape. Bring them back down in a controlled manner, and repeat. Always remember to start with a light weight, or you may go for lower impact alternatives with single dumbbell or without weight. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We are doing tricep dips next. Place your hands on the armrests or the chair. Push yourself up until your arms are fully extended, then slowly lower yourself down until you are fully seated again, and repeat. Make sure the hands are directly beneath your shoulders, and do not lock your elbow. It should have slightly bent to avoid elbow joint injury. If it is too difficult, you can help yourself with your legs, but try let your arms do the work as much as possible. Just try your best, and let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have got overhead triceps extension next. Lift 1 dumbbell overhead. Slowly bend your elbows and lower the weight behind your head as far as you can. Then, at the lowest point, straighten your elbows and extend the weight back overhead. Make sure you have a firm grip on the dumbbell and keep the head and the body stable. Be sure to keep the elbows tucked in near to the ears to avoid flared elbows. For lower impact, you may perform this by pushing down a resistance band behind your neck. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse flyer next to train the upper back muscle. Hold the dumbbells at both sides. Bend over, bringing your chest forward. Raise both arms out to your side and then go wide. Exhale as you raise and inhale when return back to start position. Make sure you don't round your back as it can place too much stress on your lumbar spine. Always remember to engage your core and not to swim the weight by momentum, but in a slow and controlled movement. Alternatively, you may take a resistance band in both hands with some slack in between directly in front of you with straight arms. Spread the arms backward and slowly control the arms forward until you return to the starting position. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's get into the core workout with abdominal hollowing. First, take a deep breath in. Then, pull the belly button towards your spine upon exhale. Hold each one for 5 seconds, and release. It is a really simple movement, just getting your tummy pulled in as much as you can. Always remember to tighten up your core and keep your back straight all the time. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Coming up next is core rotation. Just bring your arms in front of you. Core engaged and keep the back straight. And then, twist side to side like that. Right left is 1. Just push as much as you feel comfortable, and do it in slow and controlled manner to avoid injury. Let's start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's rest for 30 seconds. Follow the video to move our limbs and adjust our breathing. Add some water and get ready for the next set of exercises. Set 2. Front raise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lateral raise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Tricep dips. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Overhead triceps extension. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse fly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Abdominal hollowing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Core rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's all about muscle strengthening exercise. See you. The last training is flexibility exercise. We will introduce you the seated versions of yoga that can be practiced on a chair to improve flexibility and relaxation. This set of exercise should be done slowly so that you will be able to feel the stretch and there is no equipment needed. Let's start by raised hands pose. Facing forward with your arms down by your sides. Take a long, deep breath in and slowly stretch your arms upward to the ceiling. Hold this position for a moment and bring your arms back downward, chin to chest with a long exhale. It is important to maintain a good upper body posture with the shoulders relaxed. Coming up next is spinal twist. Put your left hand on the right knee. Hold the back of your chair with your right hand, inhale deeply and gently twist your body. Hold in this position for several breaths and breathe out when returning to the original position. Repeat the same on both left and right side. Do not overstretch and just twist your spine, as per your flexibility. Your back and neck should be straight while doing this exercise. Last is forward bend. Start by reaching the arms up and take a deep breathe in. Slowly bend forward as far as you can when breathing out. Hold in this position for several deep breaths in and out through the nose and return to the upright position. Always keeping your back and neck relaxed while having your feet flat on the floor. That's all about flexibility exercise. See you.
Congratulations! You have completed the training. Make physical exercise a habit. See you tomorrow.